Hi everyone, welcome back again. Hope that was an opportunity to have a quick comfort break. We're moving right along with Katy's presentation. This is Katy Brickley, who's our research assistant, and she's gone above and beyond while suffering from COVID. She's made a recorded presentation about a literature review that we've been doing about involving service users in inspection and regulation of services. So we're going to play her presentation, and then we've got Shalim Ali, a member of the research team, an expert by experience himself, and he's going to answer some questions about his experiences of working as a quality checker. So I'm going to play Katy's presentation first.
Involving end users in the inspection and regulation of public services, a systematic review. Hello, we are Katy and Shalim, research team members on the Feeling at Home project. Today we're going to talk about how service users are involved in the inspection and regulation of public services such as education, health and social care. I'm going to briefly explain what Deborah and I wanted to find out from our review of the literature and how we did it, outline some of our main findings, explain what we think this will mean for our Feeling at Home project, and finally, Shalim will then talk about how this relates to his role as an expert by experience. One of the end goals of our research project is to create a checklist as part of a toolkit that service users, inspectors and housing providers can use to make sure group homes can feel homely for the people living there. We wanted to learn what other studies had found out about what works and doesn't work when service users are involved in inspection and regulation. When reading the literature around this topic, we asked, what unique skills and insights do service users bring? What things help service users to get involved in inspection and regulation? And what things make it difficult for them to do so? We only included research which looked at how users are involved in collective and proactive ways. So this means excluding from our study feedback and user groups designed to inform regulation, and excluding individual and collective involvement in reaction to someone not following the rules or to a complaint, for example. I've given a really brief overview here, but if you're interested in the details of our search criteria, please do get in touch.
I just added a little bit of information here to say about the databases that we examined and the number of studies that we found, and they were in a really wide range of different settings: sexual health clinics, schools, residential services, pharmacies and mental health services. Back to Katy.
So the first thing to highlight is the range of different names that are used for this type of role. We can see here from the diagram that when a service user was involved in either the regulation or inspection of a service, they could be called a quality checker, a lay assessor, a lay inspector, an expert by experience, a mystery guest, a simulated patient, a simulated client, or a mystery shopper. Although the roles these terms describe have much in common in terms of supporting the regulation and inspection of services, they also varied in the following ways, although not consistently. For example, they could be announced or unannounced. They could be mystery, or they could declare themselves on arrival. They could be paid or volunteers. They could have lived experience of the service or just be non-staff. They could have a professional or a non-professional background. They could be trained or untrained in inspection processes and to varying degrees. And they could be involved through chats, reading reports, attending meetings, or completing checklists, for example. And they could give their responses verbally or in written reports. So this research really demonstrated that we need to be careful and not assume what these terms mean, and that they're not always synonymous. From our literature review, authors describe service users as having the following unique skills and experiences. They say they have a fresh or unique perspective as actual users of the service, their families or community. This is also referred to as having naive eyes and often considered the most important reason for involvement, and is largely used to justify users' involvement. They have the time and inclination to look at the softer aspects of care, for example, how a place feels, its friendliness, its decoration, and also to ask users' views and opinions. They have an informal approach and can build rapport with service users, with inspectors found to sometimes be intimidating to service users. And they have a broad reach, being able to check significant numbers of services and speaking to many users. And mystery shoppers specifically can offer insight into daily practice, regarded as seeing things in real life. What can make it difficult for service users to get involved in inspection and regulation? The research revealed a range of difficulties. The most salient were the fuzzy role. Research reports that many stakeholders have conflicting ideas about the role and its responsibilities, including policymakers, MPs, inspectors, lay assessors, and clients, with Adams et al. Identifying a blatant lack of clarity in the Dutch Health Inspectorate, where user involvement seems highly researched. Conflicting opinions. Users and families and inspectors all had different views on what should be considered good quality care, making it difficult to measure. A lack of diversity, particularly highlighted in the recruitment of lay assessors, with many coming from a professional background. Professionalisation. This is a term Rutz et al. Used to describe the problem of people losing their fresh perspective because they received so much training. And lastly, successfully including user knowledge in the final inspection report. This can be for various reasons. Some researchers found that the user view is undervalued by the inspector. User knowledge is not just not regarded as legitimate or proper knowledge, prioritising their own view or only incorporating the user's view when it agrees with theirs. Another issue is that the institutional framework doesn't allow for user-type knowledge to be incorporated. Richardson et al. Describe user involvement as being somewhat transactional, that is, produced to fit into institutional systems, but with little feedback for the user themselves. So what helps service users to be effective in this role? The literature found that training for users in inspection processes could be helpful, but this was complicated, as suggested already. How much training? On what topics? What training lets users do the role without them losing their special status as having fresh eyes? Some experts by experience had training on what makes a good or bad home. Doesn't this frame their ideas to fit into the institutional narrative? Wig et al. Identified that training was also needed to teach inspectors how to incorporate different perspectives on quality, which is an interesting approach. Our review also found that users could be included earlier on in the development of inspection criteria to help overcome conflicts between the views of inspectors and service users. Given the time and money needed to include users, a further aspect to support user involvement was to make use of current systems. And finally, using inclusive recruitment methods was also identified as a key way to support diverse user involvement, with England being highlighted for the efforts made to make forms and websites accessible. What does this mean for our project? The research underscores that there is real value in including service users in inspection and regulation, but has highlighted there are areas where improvements can be made to how they are being involved. We found it was important to ensure that experts by experience were involved in inspection and regulation in a way that wasn't tokenistic. The literature suggests there is a difficult balance between offering enough training so they are supported to do their work and that their views can be incorporated into the final report, but not too much training in policy and regulation and what makes good care that they no longer have their unique perspective based on their experiences as a user. It seems also important to include users much earlier on in the inspection process and with a well-defined role, co-creating the criteria for how the quality of the home will be measured and including their ideas of what makes a good home, or what makes somewhere homely in this instance. Our planned homeliness checklist aims to capture experts by experience findings against criteria set by people with similar experiences. We hope this will increase the likelihood that these findings are included in the final report. In terms of making use of current systems, we hope, where possible, to work with regulators and internal inspection and audit teams when producing our homeliness checklist, sharing our toolkit and resources widely. The issue of a lack of diversity in the recruitment of experts by experience and users was raised time and again in the research and is something we need to consider in our Feeling at Home project, both in the recruitment of participants to the Photo Voice groups, but also in terms of who uses the checklists and how we can influence that, perhaps via our toolkit for service providers. The review of the literature has been highly useful for helping us shape the project, but has also highlighted that there is a lack of research in this area and that further research is needed on evaluating user involvement. It will therefore be really important for us to evaluate our checklist and toolkit once designed. I'll now hand over to Shalim to give his thoughts on these issues.
Okay, I'll stop sharing. And Shalim, could you turn your camera on? Oh, you've got your camera on. Brilliant. I'll turn mine on. And again, thanks to Katy. That was fantastic. Really great to have the opportunity to hear your presentation and all the hard work you've done. So I've got a couple of questions to kick off, but then maybe if people have got other questions they'd like to ask Shalim, who I guess is really going to be talking most about his role as a quality checker. So Shalim, my first question is, how do you get to be a quality checker and what qualities do you have to have?
I think you have to have good communication, good people skills, good listening, good leadership, and able to kind of adapt to the support that you're getting, and on a professional level and also on a personal level. So you get to know them roughly, but also when you come into a service to kind of be quite welcomed by the service users and the staff as well. And that's the way it should be when you walk in.
Well, I think that's a really quite a long list of qualities. Can you tell us a little bit about how you find out information from service users when you do the quality checks? How do you go about finding out what they're thinking and feeling about where they live?
So we have a set of questions that we lay out to the people that they are supporting, and we ask them how they're feeling, or what kind of activities they're doing, or how homely they are, or have they made any friends with the people they live with, their similar interests and hobbies, and we try and break it down and try and address it as much as we can.
How did you make your questionnaire, Shalim? Was that something that you were given, or did the quality checkers make it up themselves?
The quality checkers made it up themselves.
Right. Okay. I can see some of the people in our audience have got some questions for you. Sure. Jenny, you've got your hand up. Is there something you'd like to ask Shalim?
Yeah. So my question is about what have you found most challenging about this role? And what are the things that we could learn from you to help people that we might work with in the future?
I think kind of the challenging is kind of understanding the non-verbal people, to kind of have more support from the staff to kind of elaborate on what they do during the weeks. Just kind of break it down for us to write our reports as well.
Jenny, do you work in a service with quality checkers, Jenny? Is that why you are asking those questions?
No, I don't, but I'm Well, I'm just starting my PhD research with Georgina, who's been quite active in the chat, and I would like to involve community members as much as possible as co-researchers. So it's interesting for me to understand how people, because it's a similar kind of process, I guess, being a quality checker to being involved in research and doing kind of interviews with other service users as part of that co-research piece. So that's my interest, really.
Okay. Maybe some other, thanks for your answers so far, Shalim. Have other people in the audience got some questions? I've got a few more if we, oh, Christine, thanks. Would you like to go ahead? And Sam's also got a question for Shalim. Christine.
Hi, Shalim. Nice to see you. I'm just wondering, Shalim, whether checkers should be living in the organization's homes they are checking, or should they be independent?
I'm
wondering. I'm sorry. Carry on.
They should really be, I'll say 50-50, just as my personal opinion. But yeah, just see how it goes.
Why do you say 50-50? What do you think if they live in the same home, or they live in the home which is owned by the same organisation, is it easy to be free and, you know, like say whatever you like? I don't know. Is that what you're getting at, Christine? Something about...
Yes.
Yeah. Like, so if you're inspecting a choice support home, is it easy to say things, talk about things that are not going well if choice support are paying the quality checkers to do the checking?
It's
a hard one. I think Phil's here as well.
Probably yes.
Yes. Okay. All right. You're being very diplomatic, but I think that's an interesting issue that Christine has raised, because some, like Phil's here. Hi, Phil. From some organisations like employ their own quality checkers, right, Phil? To check that. Yeah.
I think Shalim's right. There's no harm in having both. I think it's important that if people are using a service, they should feel empowered to stand up and say whether they think something's good or not. So I don't think there's any harm in people visiting other services within their own, providers or whatever. But again, the benefit of having somebody who isn't connected to the provider is that there's no conflict of interest. Somebody's just going in there and feeding back what they hear. The thing about quality checkers and experts by experience when they do their work is that they reflect the voice of the people who are using the service. So it shouldn't be their opinion anyway. It should be the opinion of the people that they're talking to, that they're reflecting, whether they're reporting to an inspector or if they're reporting to, somebody within a provider organisation. Experts by experience reflect other people's views and what they've been told.
I think thank